Welcome to the deep dive. Today, we're jumping into a topic you hear about all the time, diabetes. It feels like everyone knows someone affected, right? But honestly, the details can get pretty complex, maybe even a bit confusing. So our mission today is simple. Give you a clear shortcut to really understanding it. We want to boil it down to the essential takeaways.
Exactly. At its heart, diabetes is a condition where your blood sugar levels climb too high. And in this deep dive, we're going to unpack the different types, how doctors figure out if you have it, what actually causes it, and crucially, how it can be managed effectively, and in some cases, even prevented.
And we've really dug into some solid sources for you here. We're talking big names like the NHS, the American Diabetes Association, Mayo Clinic,
Mm.
plus insights from the International Diabetes Federation and some recent research, too. The goal was to sift through it all, pull out the most important bits so you walk away feeling, well, genuinely informed.
Mm.
Okay, so you said the basic idea is high blood sugar. But it's not just one thing, is it? There are different kinds.
That's right. Primarily, we talk about two main types, and then there's a related one that happens during pregnancy. First off, there's type 1 diabetes. This is a lifelong autoimmune condition. Basically, your own immune system messes up and attacks the cells in your pancreas that make insulin, destroys them.
Autoimmune, so the body attacks itself.
Precisely. Then you've got type 2 diabetes. This one's much, much more common. With type 2, either your body doesn't make enough insulin, or, this is key, your body's cells just don't respond to the insulin properly. We call that insulin resistance.
Ah, resistance, got it. And the third one.
That's gestational diabetes. It's high blood sugar that develops specifically when someone's pregnant. Usually, it clears up after the baby arrives.
Okay, that makes sense. I saw this analogy in the sources and it really clicked for me. If glucose, the blood sugar, is the fuel for our cells, then insulin is like the key that unlocks the cell door to let the fuel in.
That's a great way to put it. So for type 1, the body stops making insulin altogether. There's just no key.
No key, no fuel gets in.
Exactly. And for type 2, it's more like, well, maybe the body isn't making enough keys, or the keys it is making are a bit faulty, kind of broken, so they don't work right in the lock.
Broken keys. Okay, that paints a clear picture. And when you look at how many people this affects, wow. It's huge. Type 2 is the big one, definitely. The numbers are, frankly, startling. Globally, something like 590 million adults living with diabetes right now. That's from the IDF Atlas for 2025.
It is. And what's really concerning is the statistic you mentioned earlier. Over 4 in 10 adults who have diabetes don't even know it. They're undiagnosed.
4 in 10, that's almost half.
It's a massive public health challenge. And the projections, well, they'd suggest it's only going up. By 2050, the estimate is around 853 million adults globally. That's a huge jump.
Why?
And another important point, over 80%, so more than 4 out of 5 adults with diabetes, live in low and middle income countries.
Yeah.
It really highlights a global health equity issue.
Absolutely. And before we move on from the basics, you touched on something called prediabetes. What's the deal with that?
Right, prediabetes. It's sometimes called non-diabetic hyperglycemia. Think of it as a warning stage. Your blood sugar levels are higher than normal, but they haven't quite crossed the threshold for a full type 2 diabetes diagnosis yet.
Oh, so like a yellow light.
Exactly. It often doesn't have obvious symptoms, but it significantly, really significantly increases your risk of developing type 2 diabetes later on. It's a critical window for intervention.
Okay, that makes sense. So let's get practical. For many people, this starts with noticing something's off. What are those common signs, the red flags for diabetes?
Yeah, the main symptoms can be quite distinct, though sometimes subtle at first, especially for type 2. Feeling really thirsty is a big one. Peeing a lot more than usual, particularly noticeable at night. Feeling very, very tired, like beyond normal fatigue.
Okay, thirst, peeing, tiredness.
Also, unexplained weight loss, sometimes with a loss of muscle bulk that's often more prominent when type 1 first appears. And then there can be things like itching around the penis or vagina or getting thrush frequently. Blurred vision is another common one.
Some of those sound like things people might ignore for a while, like just being tired or needing glasses. Is that why type 2 can sneak up on people?
That's exactly why. Many people can have type 2 diabetes for years, literally years, without knowing it because those early symptoms are often quite general, or sometimes there just aren't any clear symptoms at all.
Right.
Type 1, on the other hand, tends to hit much faster. The symptoms can come on quite suddenly, sometimes over just a few weeks or even days. Bang.
Wow, quite a contrast.
Yeah. And for prediabetes, like we said, clear symptoms are unusual. But one potential sign, often linked to that insulin resistance we talked about, is darkened patches of skin, usually on the neck, armpits, or groin. It's called acanthosis nigricans.
Okay, interesting. So say someone does notice these symptoms, or maybe their doctor flags something. How is diabetes actually diagnosed? What are the tests?
It relies on blood tests. Usually, you need a test repeated on a second day to confirm it, unless your blood sugar is really high, or you have those classic severe symptoms along with one positive test. There are a few main tests doctors use. One is the A1C test.
A1C. Okay.
Yeah, this one's pretty useful because it measures your average blood glucose over the last 2 or 3 months. Gives a longer-term picture. And the bonus, no need to fast beforehand, the results are given as a percentage. Below a certain level is normal. A range above that indicates prediabetes, and then 6.5% or higher usually means diabetes.
So it's like looking back over time. What else?
Then there's the fasting plasma glucose test, the FPG. For this one, you do need to fast no food or drink except water for at least 8 hours beforehand. It checks your blood sugar level at that specific moment after fasting. Again, there are specific cutoff points in the results that tell the doctor if it's normal, prediabetes, or diabetes, like 126 milligrams per deciliter or higher points towards diabetes.
Okay, fasting required for that one. Makes sense.
There's also the oral glucose tolerance test, the OGTT. This one takes a bit longer, about 2 hours. They check your blood sugar level first, then you drink this special, very sweet glucose drink, and they check it again 2 hours later. It shows how well your body actually handles processing sugar.
Like a stress test for your sugar processing system.
Kinda, yeah. And the results at the 2-hour mark help classify things. 200 or higher generally indicates diabetes.
Gotcha. Any other?
And finally, there's a random plasma glucose test. This is just a blood check done at any time of day, usually if someone comes in with really severe diabetes symptoms already happening. If that result is 200 or higher, along with symptoms, that strongly suggests diabetes.
So several different tools in the toolkit.
Absolutely. And a quick note, if someone is diagnosed with prediabetes, the advice is usually to get checked for type 2 diabetes every year or two after that. Keep an eye on it.
Right. Monitoring is key. Okay, let's connect this back to the bigger picture. Why? Why do some people get diabetes and others don't? What are the underlying causes, the risk factors?
Well, the fundamental issue, remember, is the body not being able to use glucose properly for energy. Either not enough insulin or the insulin isn't working effectively. But why that happens differs between the types. For type 1 diabetes, it's that autoimmune process we mentioned. The immune system mistakenly targets and wipes out the insulin-producing beta cells in the pancreas.
Right, the body attacking itself.
Yeah. And currently, there are no lifestyle changes known to prevent it or lower your risk. The main known risk factors are really about genetics and family history. Having a parent or sibling with type 1 increases the odds. Age is another factor. It often develops in childhood or adolescence, but, important note, it can definitely appear in adulthood too.
So not just a childhood condition then?
Not exclusively, no. And there's some really exciting research happening now looking at therapies like teplizumab, which can actually delay the onset of type 1 in some people at high risk. Others are looking at preserving the beta cells that are left. It's complex, costly research, but critical.
That's hopeful. Okay, so that's type 1, mainly autoimmune, genetic links, with research trying to intervene. What about type 2?
Type 2 diabetes is a bit more complex in its causes. It's primarily driven by factors that lead to that insulin resistance we talked about. It's often a combination of things: lifestyle, genetics, environment.
A mix of factors.
Definitely. And the huge global rise we're seeing, it's strongly tied to big societal shifts. More people living in cities, populations getting older, less physical activity generally, and crucially, increasing rates of overweight and obesity.
Right, those wider trends play a huge role.
They do. So key risk factors for type 2 include being overweight or obese, especially carrying extra weight around the waistline. There are specific measurements like over 40 inches for men, 35 for women, that flag higher risk. Also, an unhealthy diet, not getting enough physical activity, and age, the risk tends to go up after age 35 or 45.
Okay, weight, diet, activity, age, pretty major ones.
Yep.
Family history matters for type 2 as well. Certain medications, like steroids or some antipsychotics, can increase risk. Other health conditions too: high blood pressure, low levels of the good HDL cholesterol, high triglycerides.
Triglycerides, those are fats in the blood, right?
That's right. Also things like obstructive sleep apnea, PCOS, polycystic ovary syndrome in women, and even smoking tobacco.
Smoking, too. Wow, it links to so many things.
It really does. And it's also important, as the sources highlight, that type 2 diabetes prevalence can be higher in certain racial and ethnic groups, Black, Hispanic, or Latino, American Indian, Asian American communities. This isn't just genetics, it's deeply intertwined with complex structural issues, inequities in healthcare access, access to healthy food, safe places to exercise, systemic factors.
That's a really crucial point about the social determinants of health. You also mentioned metabolic syndrome earlier. How does that fit into the type 2 risk picture? Yes, metabolic syndrome. It's basically a cluster of conditions that often occur together. Think high blood pressure, low good HDL cholesterol, high triglycerides, high blood sugar, and that larger waist size we mentioned. When you have several of these together, particularly alongside obesity, it significantly ramps up your risk not just for type 2 diabetes, but also for heart disease and stroke. They're all interconnected.
Okay, so it's like a warning constellation of risk factors.
A good way to put it. And briefly, for gestational diabetes, the risk factors often include being overweight or obese before getting pregnant, having a close relative with diabetes, or having had gestational diabetes in a prior pregnancy.
Got it. This raises a question, though. Are there other, maybe rarer types of diabetes beyond these big three we always hear about?
Yes, absolutely. And knowing about them can be really important for getting the right diagnosis and treatment. A key example is MODY, that stands for Maturity Onset Diabetes of the Young.
MODY. Okay, what's that about?
It's a rare form caused by a mutation, a change, in a single specific gene, and it runs very strongly in families. If a parent has a MODY, each child has a 50-50 chance of inheriting it.
Wow, 50-50, that's high.
It is. And people with MODY are usually diagnosed young, typically under 25. But here's the catch. They often are overweight and might have a healthy lifestyle, so it frequently gets mistaken for type 1 or even type 2 initially. Maybe up to 90% of cases are misdiagnosed at first.
90%, that's huge. So getting the diagnosis right is critical.
Absolutely critical, because the treatment for MODY can be very different depending on which specific gene is involved. For instance, the most common type, HNF1 alpha MODY, often responds really well to tiny doses of certain tablets called sulfonylureas, maybe avoiding insulin altogether.
Really? So not automatically insulin like type 1 often is.
Exactly. Another type, glucokinase MODY, often causes no symptoms at all, might only get picked up during routine checks like in pregnancy, and usually doesn't require any treatment.
No treatment. Fascinating. So how do you confirm it's MODY?
It requires specific testing, blood tests to check for certain antibodies, C-peptide levels, which indicate insulin production, and then targeted genetic testing to look for those specific gene mutations. It really underscores how personalized diabetes care needs to be sometimes.
It certainly does. Okay, so pulling all this information together, what does it mean for us day to day? How can people actively prevent type 2 diabetes? And for those already living with any type, how can they manage it effectively to, live well?
Great questions. Let's start with prevention, specifically for type 2, because remember, type 1 isn't currently preventable. The research here is actually really encouraging. Studies have shown you can slash your risk of developing type 2 diabetes by over half, 58%, with some achievable lifestyle changes.
Over half. How?
By losing a moderate amount of weight, around 7% of your body weight. So for someone weighing 200 pounds, that's about 15 pounds. Doesn't have to be drastic.
Okay, 15 pounds. Manageable for many.
Exactly. And combining that weight loss with moderate exercise, think brisk walking for 30 minutes, 5 days a week, even just losing 10 to 15 pounds can make a massive difference in risk.
That's really empowering news.
It is.
Yeah.
So the key lifestyle pillars are healthy eating, regular physical activity, getting to and maintaining a healthy weight, definitely quitting smoking if you smoke, and cutting back on alcohol. And for people already in that pre-diabetes stage, these same changes can actually help bring their blood sugar levels back down into the normal range. It can potentially reverse the course.
Amazing. Okay, so that's prevention. What about living with diabetes day to day?
Managing diabetes is definitely a commitment, but very doable. It involves that healthy eating pattern we talked about, focusing on nutrients, fiber, lower fat and calories, lots of fruits, veggies, whole grains, lean protein, and being mindful of refined carbs like white bread, rice, sugary stuff.
So diet is foundational.
Absolutely. Regular exercise remains crucial. That 30 minutes of moderate activity most days is still the goal. And then there are regular checkups and monitoring. This includes regular blood tests with the doctor, but also often self-monitoring blood sugar levels at home. For instance, someone pregnant with gestational diabetes might need to check their levels 4 or more times a day, usually first thing in the morning and after meals.
Wow, that's quite intensive during pregnancy.
It is to keep both mother and baby safe. For people with type 1 diabetes, taking insulin is essential for life. That might be through multiple daily injections or using an insulin pump. For type 2 diabetes, lifestyle is the cornerstone, but many people will also need medication over time, either tablets or sometimes injectable medicines, including insulin eventually. An interesting point for type 2 is the concept of remission. Some people, particularly if they achieve significant weight loss, often through structured, low-calorie diets under medical guidance, can actually get their blood sugar back to normal levels without medication. It's not a cure, but it's a possibility for some.
Remission. That's a hopeful word.
It is. And for gestational diabetes, after the baby is born, it's really important to get blood sugar checked again, usually around 6 to 12 weeks later, to make sure it's returned to normal. If it hasn't and maybe shows prediabetes, then those preventative lifestyle steps become really important going forward to reduce the risk of developing type 2 later.
Right. Follow-up is key. Now, beyond all the physical stuff, the diet, the exercise, the monitoring, getting a diagnosis like this must be tough emotionally. It's a big life change. What about the psychological side, and how does education fit in?
That's such an important aspect. You're right. A diagnosis often brings fear, anxiety, maybe a feeling of being overwhelmed or helpless. The research, like findings from a study called BEN-D, really highlights this, but it also shows the power of good patient education. Structured programs where people learn about their condition, often in small groups over several weeks, make a huge difference.
Also,
They significantly improve quality of life, both physical and mental well-being. They demonstrably reduce anxiety and what researchers call diabetes-related distress. People in these programs often say they feel much more reassured, more confident. They learn practical self-management skills like understanding food labels, how and when to test blood sugar, proper foot care, things like that.
so it empowers them.
Absolutely. The feedback is really telling. People talk about feeling more in control, being relieved they don't have to cut out all the foods they enjoy, finding comfort in learning alongside others going through the same thing, and appreciating supportive educators. It really helps shift the mindset from feeling like a victim of the condition to taking active, informed responsibility for managing it. Education is empowerment here.
That sounds incredibly valuable. It really leads to the next point. Why is all this management, this diligence, so vital in the long run? What are the risks if diabetes isn't managed well?
That's the crux of it, really. If diabetes is left untreated or just poorly controlled over time, those consistently high blood sugar levels start to damage blood vessels and nerves throughout the body. This can lead to some very serious long-term health complications.
Okay, so the high sugar itself causes damage over time. Like what?
It can affect almost everything. We're talking major cardiovascular problems. High blood pressure, high cholesterol, which dramatically increases the risk of heart disease and stroke. Even prediabetes, that warning stage, has been linked to silent heart attacks that people don't even realize they've had.
Wow, even prediabetes carries heart risks.
Yes. Then there's kidney disease, what's called diabetic nephropathy. Diabetes is a leading cause of kidney failure. Nerve damage or neuropathy is another big one. It often starts as numbness or tingling, usually in the feet and hands.
I've heard about foot problems with diabetes.
Exactly. That nerve damage in the feet means you might lose feeling. Combine that with potentially reduced blood flow, also common in diabetes, and it's a dangerous mix. Small cuts or sores on the feet might go unnoticed, heal poorly, get infected, and can lead to serious ulcers. In the worst cases, this can result in amputations.
That sounds terrifying.
It's a major concern, which is why foot care is so emphasized. Then there's eye damage, specifically diabetic retinopathy, damage to the blood vessels in the back of the eye. If it's not caught and treated early, it can lead to vision loss and even blindness.
Blindness. Goodness.
Yeah, which is why everyone with diabetes age 12 and over should get their eyes screened regularly, usually every year.
Okay, so heart, kidneys, nerves, feet, eyes, anything else?
Other potential complications include things like fatty liver disease, being more prone to infections generally, and slow healing of any sores or wounds, not just on the feet.
It really sounds like uncontrolled diabetes can just wreak havoc across the whole body over time.
It absolutely can, and that really underscores why those regular checkups are so crucial. The annual foot checks with a professional, the eye screenings, and importantly, not waiting for those scheduled appointments if you notice any changes yourself, like new vision problems or a sore on your foot that isn't healing. Get it checked out right away. Diligence makes all the difference.
And there you have it. We've covered a lot of ground today in this deep dive on diabetes. We've looked at the different types, type 1's autoimmune roots, type 2's linked to insulin resistance, the specifics of gestational diabetes. We've unpacked how it's diagnosed using various tests, dug into the complex web of causes and risk factors, including those rare forms like MODY. And importantly, we've explored the powerful strategies for prevention, especially for type 2, and the key elements of effective management for living well with the condition.
It really does come back to knowledge, doesn't it? Understanding your own risk, knowing the signs, understanding how to manage the condition if you have it, it's all key to achieving better health outcomes and ultimately a better quality of life.
Absolutely. So here's a final thought to leave you with. We heard that staggering statistic earlier. Over 4 in 10 adults with diabetes globally don't even know they have it. Hundreds of millions undiagnosed worldwide. Knowing that, what does it suggest about our collective responsibility, maybe within our own families, our workplaces, our communities, to raise awareness and encourage, perhaps even ourselves, to get checked out if they have risk factors or symptoms? Something to reflect on. The power of early detection and intervention.